for me, I've got sort of two headache candidates coming out of this, and that's Amy Klobuchar and Pete Buttigieg. Um, like that, just like really, like, guys, come on. Like, I don't know what the hell they're thinking. Um, but so I think I think this might get to it. So it was an article. It was an article that was published in Jacobin Mag, and I'll post a link to it. And I'll pull it up for right now. Obviously, I understand that some folks may have a problem with something that leans that way, but this is actually a fairly like it's not really a red or blue type of a position to take. It's more of like it's more analytical, to be sure. But basically the article is called "What Liberals Miss About Trump Country," and I'll I will hop over to the other side just so that folks see this really quick. So if you go to the website, this is what it'll look like. So definitely give the article a good read, because there's a lot of really like there's decent content in this, and I think it's worth taking the time to check it out. But basically, what this article is talking about is the way that liberal media portrays Trump country as this monolithic group. And further down, he points out here, income and voting are tightly linked in U.S. politics. Higher income people are more likely to vote and are more likely to vote Republican than people with lower incomes. And he has most of these link out to actual statistical websites or real studies that happen. So these aren't just links to other random opinion articles. So at any rate, though the image of the uneducated white Trump voter is omnipresent in American political discourse, the fact that Trump's support comes from disproportionately from the affluent is seldom mentioned. So he says he goes on to talk about this report here. Found that while Democratic voters by and large hold similar economic ideologies, whether rich or poor, Republican voters are deeply divided by income. A majority of Republicans earning less than $40,000 a year supported raising the minimum wage, while among GOPers making more than $80,000 a year, which is like that's so that's sort of like on that split that I talk about a lot on here, like that 70 to 80,000 bracket, where all of a sudden you're doing fine, and now you're like, and I'm not saying this for everybody, but honestly, like once you hit that comfort level, you start to get that, especially if you're pulled back from society or you live in a rural area like this, it's easy to think like, okay, well, now I need to really protect what I have and like don't come take this. So all of a sudden you see a super shift into a more conservative mindset because people get really, really nervous that someone's going to come take this. They've finally gotten it into a nice zone, and they're comfortable, and they don't want anyone to put them back into an impoverished state. So at any rate, while GOPers making more than $80,000 a year, less than 40% supported such a raise. So the gulf was even wider on issues like mandatory paid family leave and taxing the rich. So this is like, they talk about how that also maps onto systemic perception of systemic inequality caused by unfairness, like or economic inequality caused by systemic unfairness. So that's like, and that makes sense too when you just apply logic to the whole scenario and think, well, what is it like when I go and talk to a conservative person that I know and how they feel about this or that. So at any rate, um, basically, where this article really goes is that by assuming that Trump voters are somehow this monolithic group, that there's not this like sharp divide in views, is really not acknowledging the breakdown of what people want and the way people understand uh, division in society. And what this highlights is it highlights very much so how class is actually a much greater determinant of just quality of anything, quality of life, quality of infrastructure, quality of healthcare, which is exactly where we're going with this next. Because I really wanted to give this sort of like, I wanted to go off a little bit on this notion that Pete Buttigieg uses, because he's in the debate he used a very like, there's videos of him talking about how he wants to move the goalposts, like, and this is stuff that was back at the beginning of the year. And now he's actually using a conservative trick, right? Of reframing. He's talking about moving the goalposts, but he's actually moving the goalposts in the right, like back to the right, by framing the entire healthcare conversation in terms of choice. Okay? Because, well, I'm gonna pull up the clip just so that we can we'll watch along with this, and actually, actually hit the detail points and sort of stop, and I'll try and explain it as it's going, because it's just like, yikes, dude. I just, it's funny because he talks so much about how he's like, he was inspired by Bernie and all this. This stuff could not be any further from Bernie. Like, it really couldn't. Like, this is like the polar opposite. So, all right. Yeah, okay. We're gonna do this right now. So here we go. Okay, hold on. No, I'm gonna stop this right, because like, all right. So what he's talking about, right? He says like, people want choice of Medicare for all, or they want, you know, they want to choose their health insurance, right? Or they want to choose their health care. I think actually, that's an important bit. I need to figure that out, because if it's like, I gotta go back. Let's see here. So he doesn't even specify. He just says, we just want a choice, right? Like, I'm sorry, man. Okay. Oh, wow. I'm so sorry, folks. I have had the desktop audio off this whole time, so none of this has been playing. So I'm gonna have to hop this back. But I'll get used to this at some point here. So
Respond? Sure.
I don't think the American people are wrong when they say that what they want is a choice. And the choice of Medicare for all who want it, which is affordable for everyone. Because
okay, so what he's talking about right there, okay? He says, well, the American people want a choice. Why is he saying American people want a choice? Well, because that's what Americans want, right? Americans want to choose everything. We want to have a million choices. We want to have 21 flavors at Baskin Robbins. We want to have, like, I want to have like 17 different flavor shot choices at fucking Dunkin' Donuts. And like, look, there are plenty of studies that you can dig into about how choice causes anxiety for people, and how actually when you limit choices, it actually creates like greater interest and likelihood of engagement. But setting that aside, the choice that he's talking about is fundamentally not the choice that is in question. Okay, Pete's living in this world where you can't question the things that have already happened, or you can't question a paradigm and say, hey, maybe this is not right and maybe it could be better, or maybe we did this wrong from the start. Now, the point here is that, Pete's saying people want a choice. Well, what people want to choose is they want to choose their doctors. That's it. They want to choose their health care. They want to have if they're getting a bad result with a certain doctor, they want to go and they want to see a different doctor. Okay, that's the type of choice that people want in healthcare. When you talk about like health insurance, nobody care. Okay, like this is like, in my head, I'm like, this is like being a prisoner, being told you're sentenced to death, and being asked how you'd like to die, as opposed to just saying, hey, can I have a lawyer? So in that scenario, what I mean is like, look, the choice we should be making is the choice between whether or not we want to commodify our health insurance in the first place. Like, if we want to bring private industry into caring for our sick and our aging, like, something that's clearly motivated by profit alone, right? And until there's some odd tectonic shift, at the end of the day, corporations are still going to be mostly focused on profit. And any like green appeasing or like, cultural virtue signaling that they're doing, like, you know what? Like, all that is in the interest of maintaining or improving their bottom line. So always keep that in mind, that the goal of being in the business is to just make money. In any business is to make money, okay? Like, that's what business is. That's what capital is. It's about just increasing profits. So as long as you include that profit motive right there at that point where people are the commodity essentially, or people are the ones that would lose out because of the lack of commodity, like, then you are killing folks. You're just straight killing folks. And I'm going to use that word folks right there because they're good, regular people. Like, they're not doing anything wrong. Like, these are moms and dads and brothers and sisters and children and grandmothers. Like, dude, like, these are good people that don't deserve what we do. That's the choice. Not choosing between a noose or a bullet. Like, honestly. So at any rate, I will. Well, I'll keep going here. So this is,
because we make sure that the subsidies are in place,
yeah.
allows you to get that health care. It's just better than Medicare for all, whether you want it or not. And I don't understand why you believe the only way to deliver affordable coverage to everybody is to obliterate private plans, kicking 150 million Americans off of their insurance in 4 short years.
Okay, so there's a couple of things here. One, when he talks about like a public option, right? He's ignoring how insurance as an industry works in the first place, right? Like, so the way insurance is profitable is because healthy people buy plans and they don't go to the hospital. So for every month, year that goes by that person doesn't get sick or need to, do anything outside of like their regular checkups, which are mostly covered, or it's like a really low copay, which I personally believe there shouldn't be a copay at all. Like, you should just be able to go see the doctor, but that's beside the point. You get healthy people who aren't getting sick to come in, they're paying their monthly premiums, and they're, maybe they don't even meet their deductibles, so they're always just everything like that. It's nothing but profit off them, right? Because they're just there's no payout on the insurance company's part. Like, they don't have to do a whole lot of compensating to the hospital or the doctors, or it's a lot less. When you got somebody who's sick, they obviously consume a lot more of the resources of the insurance company, because again, that's how insurance works. So in a private insurance model, what do you want to do? Well, you want to exclude sick people. So you have things like pre-existing conditions, and that's where that whole thing comes from, so that they can exclude people who are especially sick, who would rack up really high bills on their insurance, so that, the insurance model remains profitable for that company. So when Pete talks about the public option, the problem with that is that the people who really need it the most will likely jump on the public option. Okay? Like, good number of them. Because they don't have any options. They don't have any competitive options, okay? But by that being there, it's going to drive down the price of other competitors to a degree, okay? We're still talking about, like, enough for them to make profit, okay? So they're still profiting off of your either not getting sick, so you're just paying them to not help you. Like, and it's not like the more you pay your premium, the better your care, like, your coverage is going to get. Okay, like, that's not how that works. So you're either just giving them money, or you're like, you're going to fight with them over every single cost that gets brought to you because of whatever illness you have. And, and that's like, that's a whole other logistical thing that takes, understanding of how to read paperwork and how to, that's like, and that's another way that your freedoms are being infringed upon by them consuming your time, which should be considered an equal commodity as money. At any rate, I feel like I'm getting off track with this, but the point is that, like, you need a buy-in, right? You need to have like a broad pool means that everybody gets what they need, right? Now, the idea is that in Medicare for all, well, there's the pool is everybody. So it's, you're taking what we consider to be the premium right now. Like you're taking that and saying, no, we're just going to eat this and we're going to throw it on your tax bill. So it comes out essentially pre-tax because it's basically just the tax now. It's like instead of your insurance coming out before you get taxed, it's just rolled into the tax. So now your employer now has all that less work that they have to do, or if you are an employer, that's all that less work that you have to do when it comes to insuring your employees, or all this less work that you have to do to hire lawyers to help, negotiate the legality around like hourly staffing to make sure that your employees are all working under full time. Like, dude, no, like don't stop. Like we can just put it all on Medicare for all. Yeah, it means your taxes are going to go up. That's how that works, right? Like, but the point is that you're already actually paying more because if you do get sick, right? Like, and eventually we will all need that, okay? Like, everybody gets old, everybody gets sick, okay? Everybody has the same amount of likelihood of risk of something happening to them, just like chaos, okay? So whether you like it or not, eventually you will need that health insurance, like that health care. You will need to be able to just go into the hospital and get that care and not have to sweat it. And the guaranteed way to do that is to just take the commodification straight out of it, right? Have the government pay out the hospitals, the doctors, have them renegotiate all of the pricing, okay, of the prescription drugs and the emergency rooms and the like all of those costs that sit on this hidden ledger in the back of a hospital that like insurance companies and hospitals worked out together on their own, and none of us have any say over what those numbers are. And they just decide, oh yeah, what is it, like $1,300 for 45 minutes of having an oxygen tank in your room. Yep, boom, done. Okay, so like it's like a very, very arbitrary cost. And if you're going to need that, then the solution is to have it be Medicare for all. Now, if you want to completely undermine that goal, what do? You set up something like a public option. I actually used to be kind of for a public option personally because I was like, well, just give me anything. But the more that I've sat on this idea and thought about it and the way it would play out, like, it's not going to work because it's fundamentally going to set the people who need the healthcare the most into the public option pool, which will have like very few healthy people because they've got insurance companies that are competing for them because they know that they can make money off of them because they're profitable. So they're going to like create incentives, or they're going to try to, and the public option won't be able to compete because it doesn't have the same type of leverage behind it in terms of like getting in with the hospitals and negotiating power. It might not have like, it depends obviously on who they staff and who they have leading it and everything, but it's a risk. It's an absolute risk, and the likelihood that it's going to succeed is much, much lower. It's still going to raise taxes because it's still something that you have to implement. So you're getting that hit either way. So I mean, there's a report, and I'll as I mentioned earlier, I'll put it down in the description where you can actually look at all this stuff apples to apples, and you can make your own decision. But frankly, what it comes down to is your ethics. And how you personally feel about the word tax, if that's like triggering for you, or if you can accept that paying money is paying money no matter what word you call it. It depends, but we could stop all this. And Pete's just, so the point here is that he's, not only is he not getting like the bigger picture of like, this is like, we shouldn't even like the conversation that Sanders and Warren are trying to have is the conversation about like, hey, is this even ethical or right in the first place? And like, the only way to deal with that is to do this. So that's what they're putting out there, and especially in the case of Sanders. And he's happy to do it and is ready to explain it all. Like, Pete just like he can't even consider that might be the the conversation that we should really be having. All he can think of is his weird view of the world as like this, this Rhodes Scholar military guy who, but at the same, it's like, I don't know. There's just a lot of like, I don't know. His credentials are actually quite off-putting to me, in the sense that I think, I don't know. It's weird in a lot of ways to me. Pete like represents obviously not like, not 100%, but he really represents a certain type of like ignorant white privilege that like I just don't think he can quite wrap his head around this, and he's out of his league with these arguments. And like, by saying we're going to kick Americans off their health insurance plans, like that's further perpetuating this false narrative that somehow health insurance and health care are the same thing. Like, no, health care is your doctors. All right. That's what people care about. When you talk, people are worried about being kicked off their insurance. Well, did you tell them that they'll have a replacement? Did you actually go and, I can't speak to Warren's plan, and to my knowledge, she doesn't even have it up yet. So that's a problem, and she'll have to go and face those numbers and deal with them. But Sanders has them, and you can go read that plan now, and that's ready. And he explains it. So it's, like, it is funny though, because Elizabeth Warren did just, she said this, I think, in the last debate actually that they had, where she said, nobody cares about their health insurance provider. What they care about is whether or not they can go see the doctor they need to go see. That's what matters. Okay? Like, they care about, can I go see my dentist? Can I go see my, my cardiologist? Can I go see, can I deal with this specialist? Can I go see my therapist? All of these things, man, are so key. And, so I just, it's, it's tough. It's tough to deal with this kind of nonsense out here. And you got Klobuchar basically calling it like a pipe dream, and which is just, it's absolutely ridiculous. And this, Pete talks about like being all worried about insurance companies. It's like, dude, you know what? Who's worried about these people? Honestly, they got plenty of money, and I think, Bernie really sums it up at the end. You know what I mean? I think his ultimate call out, and the way he puts this right here is just, it's right on. So, I'm just gonna hop over and we'll just show this clip, because it's
making $100,000 a year. Their taxes are going to go up about 10 grand. That is more than they will possibly save on this health care plan. We have a plan put forward that will work.
Senator Sanders, do you want to respond?
I get a little bit tired, I must say, of people defending a system which is dysfunctional, which is cruel. 87 million uninsured, 30,000 people dying every single year, 500,000 people going bankrupt. For what reason? They came down with cancer. I will tell you what the issue is here. The issue is whether the Democratic Party has the guts to stand up to the healthcare industry, which made $100 billion in profit, whether we have the guts to stand up to the corrupt, price-fixing pharmaceutical industry, which is charging us the highest prices in the world for prescription drugs. And if we don't have the guts to do that, if all we can do is take their money, we should be ashamed of ourselves.
So, like, look, that's it. That's all there is to it right there. we are genuinely hurting ourselves to protect the interests of people who want to make money off of our pain. And honestly, a whole slew of the people up on that stage just want to keep that rolling. Now, like, you can say what you will about being concerned about big government expansion and, oh, look at, what about all the problems that could come with it? Honestly, I say you need to maybe think about what you genuinely think is right. And I think, like looking at that report, is like, I've got it up right here, so I'll put it up, here it is. Comparing the options, you've got the current, you've got what the reform is, and we go down the list, a little bit of change, I guess. Okay, when we start to get, here's what public option does. It takes it down by quite a bit, as opposed to just sort of like more expansion of the ACA, right? But I mean, right away, the second you get into public option stuff, you see the taxes pop right up. They pop up quite a bit. And yes, you go down to like 6.6% uninsured, which is certainly better. But again, your taxes are going up, right? And it's just like, you can look at without even reading the data, right? Like, obviously you can dig in and you can read the data and you can look at the numbers. But for most people, I think assessing this in terms of just its graphic representation, right? The way they're showing us this stuff. You've got, I'll pull up the mouse. Like, I'll see if I can pull up the mouse here. Okay, so like, obviously this is what our current is. And this is ultimately what it would be under, under the new plan suggested, right? So under Medicare for all, or, the expansion or whatever. So, I mean, if we scroll over this, we can see, exactly how this breaks down, right? But I think, and this is where it comes down to how, like, what your ethics are when you look at these charts. As like, when I personally look at this column right here, this gray measurement is essentially like, when you're saying number of uninsured, you might as well call that either suffering or potentially suffering. Okay, like either financially burdened or potentially financially burdened. Okay, so this is in a lot of ways, like, I don't know. For me, basically, and I think this is a fair thing to say, but that gray pillar represents a certain degree of injustice to me, or us not making sure that we're doing everything that we need to be doing for the citizens of our country, right? It means that we are somehow not doing what we need to be doing. We're leaving something up to chance that should not be left that way. And honestly, there's really only one that zeroes it out. And yeah, that tax spending goes up significantly. But what it doesn't factor in is the amount of savings that go down, like that occur when you take away that all of the copays and all of the deductibles and all that out of pocket expense, right? When you actually remove all of that from the equation, you look at like where the overall cost for the regular person who needs to go and deal with an emergency or get a checkup or get some psychiatric help for some trauma that they've experienced. Like, look, we shouldn't be restricting people from that. And that's just that's all there really is to that.